In this video, I am going to talk about the shoulder region. So the shoulder region is the region that comprises of the structures related and surrounding the shoulder joint. The muscles around the shoulder region contains Supraspinatus, Infraspinatus, Terese Minor, Terese Major, Subscapularis and Deltoid. The vessels and nerves around this region are anterior and posterior circumflex humeral vessels, axillary nerve, suprascapular nerve, and the subacromial bursa is also present. Now, let's discuss the muscles one by one. Supraspinatus takes its origin from the medial 2/3 of the supraspinous fossa, the superior surface of the spine of the scapula, and the fascia covering the supraspinatus. Insertion of this muscle. The muscle fibers runs laterally and goes and gets inserted to the upper flattened impression of greater tubercle of humerus and the capsule of the shoulder joint. The nerve supply is by the suprascapular nerve. Actions: it initiates the abduction, that is abduction from 0 to 15 degrees is done by the supraspinatus, and it is considered to be the most hard working muscle of the body. So the reason being, in the greater part of our day-to-day activities, the normal position of arm is slightly abducted always, but not vertical. So which is brought about by the supraspinatus muscle. So it is an example of the most hard work muscle. Next muscle is infraspinatus. So as the name is suggesting, infra means below. This muscle is present below the spinous process of the scapula. Origin of this muscle is from the medial 2/3 of the infraspinous fossa, inferior surface of spine of the scapula, and from the fascia covering the infraspinatus muscle. About the insertion of this muscle, the middle impression of the greater tubercle of the humerus receives the insertion of infraspinatus and also to the capsule of the shoulder joint. Nerve supply by the suprascapular nerve, and this muscle acts as the chief lateral rotator of the shoulder joint. The next muscle is the Terese Minor muscle that takes its origin from the upper 2/3 of a flat strip on the dorsal surface and the adjoining lateral border of the scapula. Insertion is to the lowest impression of the greater tubercle of humerus and to the capsule of the shoulder joint. So, to the greater tubercle, there are 3 flattened impressions. Upper one receives the insertion of supraspinatus. Then the middle impression receives the infraspinatus, and the lowest most impression receives the Terese Minor muscle. Nerve supply of Terese Minor is axillary nerve, and the action is it acts as the lateral rotator of the shoulder joint. About the Terese Major, it is a thick flattened muscle that is located along the lateral border of the scapula. That is, it takes its origin from the lower 1/3 of the dorsal surface of the scapula and the adjoining lateral border, and also few fibers from the inferior angle of the scapula. Insertion is to the medial lip of the intertubercular sulcus of the humerus. Nerve supply is by the lower subscapular nerve. Action of this is it acts as a medial rotator of the shoulder joint. Now about the subscapularis muscle. So this muscle is a large triangular muscle which fills up the subscapular fossa of the scapula. So this subscapular fossa is nothing but the costal surface or anterior surface of the scapula. Origin of this muscle is from the medial 2/3 of the subscapular fossa, including the grooved area around the adjoining the lateral border of the scapula. If you observe this muscle, there are so many tendinous septa. Insertion to the lesser tubercle of humerus and also to the fibrous capsule of the shoulder joint. This muscle is separated from the neck of the scapula from the subscapular bursa, which communicates with the shoulder joint. Nerve supply is by the upper and lower subscapular nerve. Posterior, that they are the branches given by the posterior cords of brachial plexus. Coming to the action, it acts as the medial rotator of the shoulder joint. Now coming to what is the rotator cuff. So this rotator cuff is used to describe the group of muscles and their tendons in the shoulder that helps to control the shoulder joint movements or motion. The supraspinatus is at the superior part of the shoulder and the subscapularis is anterior. The infraspinatus and teres minor are posterior. So these muscles are attached to the humeral head by their tendons. So these tendons fuse together, giving rise to a term that is called as cuff. Although each muscle acting alone may produce an isolated rotational movement of the shoulder, the role they play together is to help keep the humeral head within the glenoid cavity or the socket of the scapula. As the powerful deltoid and other larger shoulder muscle act to lift the arm overhead, these tendons keep the head of the humerus in position in the glenoid cavity. The next muscle is an example of a multipinnate muscle, that is the deltoid muscle, which is a thick triangular sheet of muscle that is covering the shoulder region. As I mentioned, it is a multipinnate muscle. That means it has got 3 sets of origin. The anterior fibers takes its origin from the anterior border and the superior surface of lateral 1/3 of clavicle. The lateral margin, the second set of fibers that take origin from the lateral margin and the superior surface of the acromion process of the scapula. So these are the middle fibers of the deltoid. The posterior fibers takes its origin from the lower lip of the spine of the scapula. These muscle fibers converge downwards to the insertion, which is to the deltoid tuberosity present on the lateral aspect or lateral surface of the shaft of humerus. The anterior and the posterior fibers of the deltoid are oblique in direction, while the intermediate fibers are short and vertical. The anterior and posterior fibers are unipinnate, while the middle fibers are multipinnate. Thus, the deltoid becomes an example for the multipinnate muscle. Nerve supply of this muscle is by the axillary nerve. About the actions of this muscle, the anterior fibers, it produces the flexion and the medial rotation of the shoulder with the clavicular fibers of the pectoralis major. The posterior fibers, it helps in extension and lateral rotation along with the latissimus dorsi muscle. The middle fibers of the deltoid, it produces the abduction of the shoulder from 15 to 90 degrees. That is, initial 0 to 15 was by subscapularis, whereas 15 to 90 degrees of abduction, it is by the middle fibers of the deltoid muscle. Talking about the relation of the deltoid, superficially the muscle is covered by skin, the superficial fascia, deep fascia, lateral supraclavicular nerves that crosses the deltoid muscle. The anterior border is related to a groove called as the deltopectoral groove that contains the cephalic vein and the deltoid branch of thoracoacromial artery. The posterior border of the deltoid is related to infraspinatus and the long head of the triceps. Now about the deep relations, or we can also call it as the structures under cover of the deltoid muscle. Contains the coracoid process of the scapula, the coracoacromial ligament, the surgical neck of humerus, upper end of shaft of humerus, the greater and lesser tubercles and the intertubercular sulcus, and all these parts are belonging to the upper end of shaft of humerus. Vessels contains the circumflex humeral vessels. Nerve under cover of deltoid is the axillary nerve. Muscles under cover of deltoid includes the coracobrachialis, the biceps brachii, the pectoralis major muscle, supraspinatus, teres minor, pectoralis minor, long and medial head of triceps, teres major and latissimus dorsi muscles. The bursa under cover of the deltoid is the subacromial bursa and the rotator cuff of the shoulder joint. After seeing the muscles around the shoulder region, we will see what is intermuscular space. The word suggests inter means between. Between the muscles, there are 3 triangular spaces, and these triangular spaces becomes evident after the reflection of posterior part of deltoid muscle. So the names of these spaces are the quadrangular space, upper triangular space and the lower triangular space. First we will see what is quadrangular space. So this quadrangular space is having 4 boundaries: above, below, lateral and medial. Above, it is bounded from front to back by 3 structures: subscapularis anteriormost, then comes the capsule of the shoulder joint, and then comes the teres minor. So these are the 3 structures forms the above boundary of the quadrangular space from front to back. Below, the space is bounded by teres major muscle. Laterally, there is surgical neck of humerus, and medially it is by the long head of the triceps. About the contents of the space, always remember when the surgical neck of humerus comes into mind, the nerve and the artery related is always the axillary nerve and posterior circumflex humeral vessels. So the same 2 are the contents of the quadrangular space. Next, about the upper triangular space. This is bounded above by the teres minor muscle, below by the teres major. Laterally, the long head of the triceps forms the boundary. About the contents, the circumflex scapular vessels that passes between the teres minor and the teres major forms the content of upper triangular space. Diagonally opposite to the upper triangular space is the lower triangular space, and this lower triangular space is bounded above, medial and the lateral boundaries. Above it is bounded by the teres major muscle, medially by the long head of the triceps and laterally by the shaft of the humerus. Now about the contents of the lower triangular space, which includes the radial nerve and the profunda brachii vessels. From here, from this lower triangular space, these 2 contents, that is radial nerve and profunda brachii vessels, they enter the spiral groove of the humerus. Talking about the axillary nerve, which is a branch given by the posterior cord of the brachial plexus, conveying the fibers from C5 and C6 axilla, it lies behind the third part of axillary artery in front of the subscapularis muscle and lateral to the radial nerve. It leaves the axilla by passing through the quadrangular space as a content of the quadrangular space, accompanied by the posterior circumflex humeral vessels. The trunk here gives branches to the shoulder joint when it traverses the quadrangular space. After emerging from or leaving the quadrangular space, it divides into two divisions, anterior and posterior divisions. The anterior division winds around the surgical neck of the humerus deep to the deltoid up to its anterior border, and here it is accompanied by the posterior circumflex humeral vessels. It supplies the deltoid muscle. About the posterior division, it gives muscular branch to Terese Minor and runs backwards towards the posterior border of deltoid and supplies it and continues as the upper lateral cutaneous nerve of the arm. It also supplies the skin over the lower part of the deltoid and the upper part of long head of the triceps muscle. Next nerve seen in this region is the suprascapular nerve. This is a nerve given by the upper trunk of brachial plexus at the Erb's point, so conveys the fibers from C5 and C6. It passes deep to trapezius and reaches the upper border of the scapula. The nerve passes deep to the superior transverse scapular ligament, which bridges the scapular notch. After reaching the supraspinous fossa, it supplies the supraspinatus muscle and winds around the spinoglenoid notch and ends by supplying the infraspinatus muscle. Here, this nerve also supplies or gives an articular twig to the shoulder joint. Anastomosis around the scapula. After discussing the muscles and the nerves of shoulder region, let's see what are the branches or the arteries that contribute to the anastomosis around the scapula. So this free anastomosis takes place around the scapula between the branches of the subclavian artery and the axillary artery. The branches taking part in the anastomosis are suprascapular artery, branch of third part of axillary artery, with the branch given by the thyrocervical trunk, the deep branch of transverse cervical artery, and the subscapular artery and its branch, that is the circumflex scapular artery. Now talking about the causes for the axillary nerve paralysis. It may be because of the subglenoid dislocation of the head of the humerus, or there may be fracture of surgical neck of humerus, or by using the crutches, which we call it as crutch paralysis. The paralysis of deltoid and teres minor with the loss of abduction of shoulder is seen between 15 to 90 degrees. That means the patient is not able to do abduction from the range of 15 to 90 degrees. There is flatness of the shoulder, loss of cutaneous sensation over the lower part of the deltoid, and the greater tubercle of humerus becomes very prominent. Injury to the axillary nerve and the suprascapular nerve will lead to the paralysis of supraspinatus, teres minor and infraspinatus muscle. So during writing, there is a lateral rotation seen. Due to the paralysis of above nerve, there is an inability to finish the sentence during the writing. Infraspinatus is the chief lateral rotator of the shoulder joint. Talking about the subacromial bursa, it is a large bursal sac present deep to the acromion process, deltoid muscle and the coracoacromial arch. It is the largest bursa seen in the body and it is shaped like a hen's egg. The floor of the sac is separated from the capsule of the shoulder by the tendon of supraspinatus. Talking about the function of the bursa, it allows the abduction of the shoulder joint, protects the tendon of supraspinatus against the friction over the acromion process. It facilitates overhead abduction of greater tubercle of humerus under the acromion process. Inflammation of the bursa leads to a condition called as subacromial bursitis.